In this video, we will talk about the calculations needed to safely give IV push medications. Now, IV push medications, I think sometimes the word push can make it sound like you're just giving it quickly and suddenly, but actually you're giving them so slowly, usually, is what's needed. And how you know how slow to give these medications is by using a drug resource, like a drug book or a drug guide, to look up how you should give these medications. So that might be a resource that's online. It might be a pharmacist that you call who accesses a resource or shows you where to look it up. You might just use a tangible book that's up to date. Just make sure it's a valid peer-reviewed source and make sure you use that drug guide. It will give you instructions on how slowly to give the medication, and that's really important to our calculations. Now I have my list of 3 steps that are necessary when giving a IV push or a slow IV medication. The first thing you're going to do is calculate how many milliliters to give. And I have here a syringe that I'm just going to put over here so you can see and think about, oh, I'm going to fill up a syringe. So when we're calculating the total milliliters to give, we're calculating, okay, let's just see if the medicine was blue. We're going to give 1 milliliter. I about colored that in. So that would be the total amount that we're supposed to give based on the dose. This is based on the order. All right. So just to clarify, this is based on the order. Then you'll also have information on the total time to give this medication over slowly, okay? This is often where your drug resource comes into play. So this is some sort of resource that you're going to use to get this information to figure out how slowly to give it. The other thing that you'll want to look up is compatibility. That's an important thing to consider, especially if you're going to give it through an IV. And then our third step is to use the total milliliters from step 1 and the total time from step 2 to determine the intervals, how much to give in each interval. So you can see here, you use the total milliliters and then you use the total time to determine the milliliters per minute and then into 15 or 30 second intervals. If you look back up at my syringe here, you're going to want to give a little bit every 15 seconds. So you'll determine and you'll keep pushing down that plunger as you look at a watch every 15 seconds or 30 seconds is the best practice. So you'll need to break it down into those intervals so you can give it evenly and slowly over the full 2 minutes, 3 minutes, 4 minutes, however long it is. And that is important to calculate. You sometimes will be asked in your questions just for the answer to step 1. So that's just the syringe. Sometimes you might be asked just for step 2, what's the total time? And you can use a drug resource or the instructions given to you to figure that out. Sometimes, and for our examples, we are going to figure out step 3, and that's this final step where we figure out actually at the bedside, how are we going to give what's in the syringe slowly? And we need to break that down into these intervals. So let's go ahead and do some practice. We're going to have to do step 1 and step 2 before we actually answer the question in step 3. So in this question, we have a patient with an order for ondansetron 4 milligrams, IV push over 2 minutes. The medication is available as a 2 milligram per milliliter solution. How many milliliters should be given in each 15-second interval to ensure a slow and even administration? Now, first things first, you know I'm big on picking out the pieces of information, the numbers that you need just for your calculation. Our first bit of calculating is to use a syringe to figure out how much medication we should put in that syringe. So how much volume should we put in that syringe? When we figure out step 1, we are looking at here first our order, and then we're going to look at our available solution. This is the vial. This available solution is usually a vial, some other way that the liquid and drug is contained. In this case, we have 4 milligrams that's ordered, and we have 2 milligrams in 2 milliliters available. You can go back to the liquid medication or injection video if you're weak on these calculations, because that's what you're doing in step 1. You're figuring out how much you're going to put in that syringe. So we always start with our order. And our order is 4 milligrams. We know we need to give 4 milligrams to this patient. Then we have our available. Our available solution is 2 milligrams in 1 milliliter. So we can just use that as a conversion factor. 2 milligrams is equal to 1 milliliter. Again, when we're converting, we know the top equals the bottom and the bottom equals the top. With this available area, you can think of it almost as if this part is just the vial itself. And that's what you're using. It's all one. It's one vial, and in it is 1 milliliter that is containing 2 milligrams of the medication. At least that's the ratio inside of it. So once we get that down, we can double check to make sure our units cancel. We have milligrams here, milligrams here. That's going to leave us with milliliters. Remember, the top here, the numerator cancels with the denominator down here. It has to be on the opposite sides. They have to be numerator and denominator to cancel the units of measure. And we're left with milliliters, which is exactly what we want to fill up our syringe. So let's do these calculations. We have 4 milligrams times 4 times 1. That's divided them by 2, and we are left with 2 milliliters for our syringe. So our syringe here, step 1, is going to be filled with 2 milliliters. That's our total volume to give. Now we have step 2. Step 2 involves our watch, or our time, our clock. Now for this information, we occasionally need to do calculations, but sometimes it's just given to us in the question. We look up here, we see 2 minutes. So our total time to give it over is 2 minutes. Now again, if you need to do calculations for this, we will show that in a later example. But sometimes you're just given this information and that's available to you. You don't have to do any calculations, but you do need to identify it. That's the total amount of time that this should be given over. So you need to give 2 milliliters over 2 minutes. Now, our third step is determining the intervals that we're going to give this in. The first part of step 3 is determining how much you should give in 1 minute. Now, you could probably try to figure this out in your head, and I do want you to have a visual of what this looks like. Imagine a syringe in front of you filled with 2 milliliters of the liquid medication, and then you also have to give it over 2 minutes. So you'll need to determine how much to give in 1 minute intervals, and then you can break it down into 15 or 30-second intervals. So we know that we need to give 2 milliliters in 2 minutes. So back to our volume over our time, milliliters per minute. Only this time we don't want to know per hour like we've done in other calculations. We want to know per minute because we are going to stand there and count this while looking at a watch. So we will simplify this fraction here, 2 milliliters per minute, and you can simplify that to just 1 milliliter per minute interval. If you want to write interval, that helps you clarify, you can absolutely do that. So 1 milliliter per 1 minute interval. Then we need to break it down into 30 seconds or 15 seconds. This question is asking us for 15-second intervals. So we know if we needed to give 1 milliliter in 1 minute, then we can just divide that by 4 to get our 15-second intervals. If we divide by 4, that's going to give us our 15 seconds. So 1 milliliter divided by 4, that gives us 0.25 milliliters per 15-second interval. If you wanted to divide it by 2 to get the 30-second intervals, if you were trying to find out just 30 seconds, you could also do that. And you can think about it because if you think about seconds, 15 seconds goes into 60 seconds, which is a full minute, 4 times. So that's why we're dividing by the 4. whereas 30 seconds goes into 1 minute or 60 seconds twice. So that's how you get this part where you're deciding like what you should divide by. How many times does that second interval go into minute? 15 seconds goes into a minute 4 times. So we divide this milliliters per minute by that 4, and we get how much we should be giving per 15-second intervals. I know these questions seem like they have a lot of steps, but keep it simple and break it down for yourself into the 3 basic steps that I gave you. Step number 1 is to figure out how much to put in that syringe. Step number 2, figure out the total time that you need to give that medication over. That's usually from a drug resource. And step number 3 is to figure out how much you're going to give in each interval. Now, don't forget your techniques of actually giving the medication. Hopefully, you'll have some lab instruction that will help you understand the importance of checking compatibility with a primary solution or the IV that's running already. But this is the basics of your calculations. And if you take it step by step, hopefully you'll have a repeatable and simple way for you to find out the answers to these questions and safely give IV push or slow IV medications. All right, our second example. Let's review our steps before we get started. Step number 1 is to figure out how much you're going to give in the syringe. Or another way to say that is the total volume. Step number 2 is to figure out how much total time that you need to give this over. And step number 3 is to determine your intervals. So let's get started. We're going to first figure out the volume that we want to pull up in the syringe. This is called the total volume. So we look first for some key pieces of information. We're going to look for our order and we're going to look for our available medication. We have a patient that requires metoclopramide, 10 milligrams, IV push. The medication is available as a 5 milligram per milliliter solution. The drug guide states to give at a rate of 5 milligrams per minute. How many milliliters should be given in 15-second intervals to ensure a slow and even administration? All right, for the total volume, we need 2 key pieces of information. We need the ordered medication and its dose, that's 10 milligrams, and it's available as 5 milligrams per milliliter solution. So that's what's in the vial. Then we can get to calculating the volume for the syringe. So we always start with our order, 10 milligrams, and we multiply it by our available. We know that the milligrams goes on the bottom here, and 5 milligrams is equal to 1 milliliter. So we have our order on the left, and then multiplying times our available solution. Here we can double check our units to make sure they cancel. Milligrams here cancels the milligrams down here, and we're left with milliliters, which is just what we want. So let's do that math. 10 times 1 is 10 divided by 5, and that leaves us with 2 milliliters. So 2 milliliters is our total volume. Now we're moving on to the total time. Now in our last example, it was nice because they just gave us the total time. It was like over 2 minutes, and so it was easy. Now we have a dose-based time. It says 5 milligrams per minute. Now some of you might be thinking, okay, 5 milligrams in 1 minute, 5 milligrams in the next minute, that equals 10. There you go, that's my time. But others of you might need to figure out a way to actually put that on paper and calculate it, and I do recommend you try to do that. So in order to find the total time, we actually have to put a little equation here. And if you are doing it in your head, I just advise you to try to do it on paper and figure out what you're doing in your head already so you can repeat it on your tests, in practice, and you can continually be safe. Now, I always recommend you go back to your order and you start with that. You know you have to give 10 milligrams, but instead of figuring out, like you were here, the volume of milliliters to give at the top here, you're figuring out how many minutes you need to give it over. And we know that we can give 5 milligrams in 1 minute. Do you see how I wrote minutes there? That's based on this information from the drug guide, 5 milligrams per minute. You can use conversion factors this way. We know that 1 minutes should be equal to 5 milligrams, and then the milligrams cancels and leaves us with how many total minutes we should give this over. So when we do this math, we get a total of 2 minutes that we should give this over. So now we know we have to give 2 milliliters in 2 minutes. And that's going to help us determine our intervals. Step 3 is always, what volume are you going to give in each interval? And we know we have to calculate 15-second intervals because that's what the question asks us. We will need step 1 and 2's information, the total volume and the total time to do this. So for the intervals, you always try to figure out what to give in 1-minute intervals first. You can do that by giving the total volume over the total time. So we know we need to give 2 milliliters in 2 minutes. If we simplify this, we get 1 milliliter per minute. And this is looking similar to our last example. Not all of these are the same, but this is similar to last one in the amount that we're going to give in the intervals. Now I'll demonstrate how I turn it into 15-second intervals. 15 seconds goes into 1 minute 4 times. So I can simply divide by 4, and that's going to give me 0.25 milliliters per 15-second interval. Again, lots of steps, but if you can break it down into these 3, hopefully you can get a simple process that allows you to reliably find the right answer. And in this case, that is 0.2 milliliters to be given every 15 seconds for 2 minutes, and that will give your medication slowly over the course of 2 total minutes. Let's do another example. We have a healthcare provider that prescribes morphine sulfate, 2 milligrams, IV push over 5 minutes. The medication is available as 1 milligram in 1 milliliter solution. How many milliliters should be given for each 15-second interval to assure a slow and even administration? So here we have, first things first, number 1, we're going to figure out our total volume. Remember how much we're going to put in the syringe. So it's kind of like an injection calculation. We need the order and we need the available. 2 key pieces of information. Then we can start our calculations for step 1. So we're going to start with our order. It's 2 milligrams, and we're going to multiply by what's available. We know we have 1 milligram per 1 milliliter in this solution. To double check to make sure those cancel, you got milligrams canceling milligrams, and you're left with milliliters. So let's do the math for this. 2 times 1 is 2. Then divided by 1, we're left with 2 milliliters. Fairly simple math there. 2 milliliters is our total volume. Again, I recommend labeling so you don't get confused midway through your equations. Now, step 2 is our total time. Let's see here what we have for time. It says to give 2 milligrams over 5 minutes. Oh, this one's nice. It gives us our 5 minutes right there. So we know we are going to give 5 minutes as our total time. We didn't have to do any math for that one. Again, sometimes you do, sometimes you don't. But the resource told us just exactly how much time. And then 3 is our intervals. So in order to break down into intervals, we always take our total volume over our total time. We have 2 milliliters to give over 5 minutes. Let's simplify that. 2 divided by 5 is 0.4 milliliters per minute. And then that's intervals. Minute intervals. Okay? Now we need to break it down into, 15-second intervals. Again, we know that we should be dividing by 4 in this case because there are 4 intervals of 15 in 60 seconds. So 15, 30, 45, 60, that's 4 intervals, 60 seconds. That's going to give us, if we take 0.4 divided by 4, we're going to get 0.1 milliliters per 15-second interval. And that's our final answer, 0.1 per 15-second interval. In this next question, we will still continue with our 3 steps. So this question, a patient requires lorazepam, 2 milligrams IV push. The medication is available as 1 milligram in 1 milliliter solution. The drug guide states to give at a rate of 0.5 milligrams per minute. How many milliliters should be given in each 30-second interval to ensure a slow and even administration? For step 1, we are finding our total volume that will be drawn up in a syringe. We need our order, which is 2 milligrams, and our available solution, which is 1 milligram per milliliter. Again, back to our syringe and what we're drawing up in it. So order is 2 milligrams, that's the dose. Ordered dose times our available. We have 1 milligram in 1 milliliter. Double check those units of measure, cross out here. Milligrams cancel milligrams. We're left with milliliters. All right, 2 times 1 divided by 1, and we are left with 2 milliliters to put in that syringe. That's our total volume. Then going on to step 2, we need to figure out the total time that we're going to give this in. This drug guide states that we give it at a rate of 0.5 milligrams per minute. So we do need some calculations here. When we do these calculations, we can always go back to starting with our order. We know our order is for 2 milligrams, and because this is a dose-based time, meaning it's milligrams per minute, we can use that information to figure out the total amount of time in minutes. So we take here our dose on the bottom that we're supposed to give per minute. We know we can give 0.5 milligrams per 1 minute. So again, that's a conversion factor. 1 minute, 0.5 milligrams. And this will allow milligrams to cancel milligrams, give you minutes, which is exactly what you want. That's the total amount of minutes. So 2 times 1 is 2. Divide that by 0.5, and you're left with 4 minutes total to give this 2 milliliters that's in your syringe. So step 3 now, we are on to our intervals. Remember, we take the total volume over the total time. So that's where we use step 1 and 2 in step 3. So total volume is 2 milliliters. We need to give that over 4 minutes slowly and evenly. 2 divided by 4, we are left with 0.5 milliliters per minute interval. And now we need to figure out what we're going to give in our intervals. If we look up here, we see our intervals are to be 30 seconds based on this question. Always double check what the question is actually asking you. So 0.5 milliliters per minute in 30 seconds goes into a minute twice. So we divide by 2 in this case, because 2 intervals of 30 seconds is what we're looking for. 0.5 divided by 2 is 0.25 milliliters, and that is per 30-second interval. Now, obviously, we could break it into 15-second intervals too, but this question was asking about 30 seconds, and so that's why we divided by 2. And now we'll move on to our final example in this video. A patient requires furosemide 20 milligrams IV push over 2 minutes. The medication is available as 10 milligrams per milliliter solution. How many milliliters should be given in each 15-second interval to ensure a slow and even administration? All right. Hopefully by now you're starting to get a hang of the 3 steps. Our first step is the total volume to give in that syringe. So we are looking for our order and our available. We have an order here, 20 milligrams, and our available solution. When we write our calculations, we always start with the order, 20 milligrams, and we know that's available as 10 milligrams per 1 milliliter. All right, so our order first and then our available. Let's double check these units of measure. Milligrams cancels milligrams, and we're left with milliliters. All right, so 20 times 1 is 20, and then divide that by 10. We are left with 2 milliliters. That's what we're going to fill our syringe with for our total volume. All right, step 2, our total time. Now, let's see, do we need to do calculations or not? It says that we should give it IV push over 2 minutes, so it gives us the total time right there, which is nice. We don't have to calculate anything. We know we need to give it over 2 minutes total. So we are now on to step 3, in which we use our information for step 1 and 2. Remember, we take the total volume and we take the total time. So we need to give 2 milliliters over 2 minutes. This simplifies to 1 milliliter per minute interval. We just simplified that equation. And then we can break it down into our intervals. In this case, our intervals are supposed to be 15 seconds. So we know 15 seconds goes into 60 seconds 4 times. So that gives us the opportunity to divide by 4 to get the 15-second intervals. So when we divide 1 by 4, we are left with 0.25 milliliters per 15-second interval. So go ahead and give these sort of questions some practice. Make sure you stick to those 3 steps and use the correct key information for each step. This can help you give IV push medications slowly and safely.